And good evening. Indiana has now joined more than a dozen other states across the country by issuing a mandatory stay-at-home order. It'll take effect tomorrow night, right before midnight. And now there are lots of questions lingering about what this order really means. Our Karen Campbell found some answers for us tonight.
Governor Holcomb's order is a lot to process, so I'm going to break it down for you and answer some of your questions posed on our Facebook page. So beginning March 25th through April 7th, anyone not considered an essential employee must stay home. So what does that mean? Who and what is open? We got a question from Debbie Dennis. She says, anything selling clothes or electronics, is that still open? Many things listed are not essential services in line with the state of emergency currently in place. Well, Debbie, I can tell you that some of the other businesses that are open, they include auto repair, repair facilities, auto supply, bike shops, even hardware stores, churches, pet stores, and home-based care. Those are some of the stores that are going to be open, that are going to be considered essential businesses. We got another question from Amanda Walls. She says, would you say car dealerships are essential? I would say no, but my husband, who is a car salesman, is told they are essential. Well, Amanda, that falls under essential business and operation. So your husband would be correct. He is considered an essential employee. So other companies that are open, construction companies, post offices, even transportation companies, including the airport and taxis. So our last question comes from Taylor Stevens. He says, I question if the news is an essential business. Well, Taylor, yes, and here's why. Because we in the news business, we work very hard to provide you with the latest updated information to keep you and everyone else informed about what's happening locally and, of course, around the world.
All right, Karen, thanks. And we've gotten lots of questions from viewers tonight. People want to know what's allowed, what's not allowed during this stay-at-home order. Here's what you can still do. You can still go out to exercise or walk your dog. Public transportation is still running for essential travel like going to the grocery or work. But businesses like spas, salons, barbershops, tattoo parlors, those will be closing. Finally, a big question tonight is this. How will the state enforce this? State police are working with local police departments to make sure everybody is following the rules. So starting tomorrow, the government is opening up a hotline for anyone with questions about essential business operations. That number and the email address are on your screen right now, and we'll also post it for you this evening on WTHR.com. Governor Eric Holcomb is preparing for another announcement tomorrow at 2:30. This one will include the state health commissioner. We'll stream that live on our Facebook page and our WTHR News app, and we'll also send you a news alert when that news conference is about to begin. Well, today the U.S. Surgeon General shared a somber warning saying that things are going to get bad this week. For the first time, our country saw more than 100 deaths in a single day. More than 41,000 Americans have tested positive for this virus across the nation. I want to show you the numbers, though, here in Indiana tonight. Nearly 2,000 people have been tested. We have 259 positive tests in our state. 7 people have died. So this warning that things could get worse sounds pretty scary, but right now the biggest threat is people thinking that they're untouchable or that the coronavirus won't impact them. The Surgeon General says the spread of this virus is getting worse because people are not social distancing themselves properly, or they're just ignoring the guidelines. So please follow this new stay-at-home order. Don't go out unless it's absolutely necessary, and try to keep at least 6 feet between you and someone else. Most importantly, if you're feeling under the weather or start noticing symptoms, self-isolate immediately. New tonight at 11, a nursing home in Noblesville is now trying to stop the spread of the virus within its own facility after 3 staff members and 3 residents tested positive. Heritage Woods Assisted Living Facility says it started with 1 nurse who tested positive last week. 86 residents live inside, and tonight that group is upgrading its infection control and staff training to keep other people from catching that virus. And starting tomorrow, first responders can take advantage of the free drive-through testing offered by Eli Lilly. The company announced plans to expand the service earlier today after its first day of tests for healthcare workers. First responders interested in getting this test should first go to management to get instructions. We've also got a link to answer your questions tonight on WTHR.com. Well, tonight, the country's top doctors are looking to a drug for malaria and lupus as a potential treatment for the coronavirus. But this is causing lots of concern for people already using this medicine. They worry about losing regular access to it. Our Emily Longnecker spoke with a woman tonight now struggling to get the medicine that she needs to make it through the day.
As a professional ultramarathoner, 47-year-old Susie Swinehart knows what it means to go the distance.
I do like 100-mile races.
And she doesn't let a chronic illness stop her. This wife and mother of 4 has been living with lupus for 19 years. That's an autoimmune disease where the immune system attacks different parts of the body. In Swinehart's case, it attacks her joints, blood vessels, and kidneys.
It's not always easy. There's days when, I get pretty depressed and frustrated.
Thankfully, she's responded well to the drug hydroxychloroquine.
The joint pain is unbearable when I'm not on that medication.
But right now, Swinehart hasn't taken it in 4 days. She ran out and got this note from her pharmacy when she tried to get more.
The pharmacist who I spoke to said it sounds like a lot of places have been stockpiling the medication.
Turns out the same medicine she takes for lupus is the same kind being tested and used on some COVID-19 patients. And right now, it's not always easy to find at pharmacies.
It's a tightrope that we're walking. We don't want to mess up anyone's lupus treatment, but we all volunteering to help fight the virus.
Dr. Cole Beeler, medical director of infection prevention at IU Health University Hospital, says the drug is being used locally to treat some COVID cases.
But we're not using it for everyone. Right now at IU Health, we're only recommending its use for patients who are sick enough to be pretty much admitted to the hospital.
Dr. Beeler says the drug's success in COVID patients still needs more testing, and that takes time.
There is some promising data behind it, but we still need a lot more data before we start recommending it more widely.
The Lupus Foundation of America just sent a letter to congressional leaders, urging them to increase FDA monitoring and reporting of medicine shortages to make sure there's enough for everyone who needs it, no matter what the reason. Susie Swinehart says if the same kind of medicine that helps her also helps those with the coronavirus.
We just need to share.
And hope the manufacturers who make it make enough to go around for everyone.
All right, Emily, thank you. Now,